welcome to our weekly call for the 23rd of June, 2022. I'm so glad you guys are here. I hope you're understanding the concepts that we're presenting here and really shifting your perspective of how clinical trials are run, and then using those extra bonus success mindset modules to expand your awareness of who you are. So delighted you're here. We're continuing with the investigator, and today we're going to talk about managing records. We've touched a little bit about that, on previous slides, but today we're going to dive a little bit deeper, the importance of maintaining accurate records, because what do? We collect all the data from the clinical research sites and we submit to the regulatory authorities. So we have to make sure that these records are accurate, right? Then we're going to continue the power of awareness for Neville Goddard. That's going to be week 8, renunciation. So let's start. Per the ICS GCPs, we have to make sure that we're maintaining adequate and accurate source documents, trial records that include pertinent observations on your clinical trial subjects. That is what the expectation is. And we had, the principle of ALCOA plus right now, and where we want to make sure that, whatever source data that we're maintaining is attributable, it's legible, it's contemporaneous, it's original, it's accurate, it's complete, right? And then, of course, we want to make sure that if there are any changes, we can actually trace those changes. And an audit trail, what just simply means that we want to know the series of activities that have taken place on the data. It's easier when it's an electronic data capture system because it's set up in such a way that whoever is given access to that system, whatever changes that they make, you can actually trace it. But on paper, the expectation is that we're not using a pencil, we're not erasing anything, and that if I see a series of corrections on a source document, I can tell who has made those corrections and when those corrections were made. And that's really important. Again, accurate data, complete, it's legible, it's meeting all the timelines for the sponsor. For clinical research sites, there are always timelines on when to enter data into the system. And it's not just done to torture you. Think about this. I mean, the more time that elapses from when you actually capture information and enter it or record it, then, you will not be able to give a full picture because your memory cannot be relied on, right? Like we say in French, ça m'échappe. My memory escapes me, but so the further it's drawn out, if you're a principal investigator and a patient comes to your clinical research site and you see them and then you wait for 2 or 3 weeks before actually taking notes, can you imagine what will happen in a clinic setting 2 to 3 weeks before taking notes? You're not going to remember any of that. Hence, we want to make sure that the data is captured instantly. And we want the data to be consistent, right? We want to make sure that all the discrepancies are resolved. So it's really doing your best. I mean, if there are corrections that have to be made, then you have to make sure that those corrections are done per the principles of good data integrity. There's a lot about accuracy, completeness, timeliness. And if there are any changes to the CRF, like I mentioned before, you want to make sure that it's initial and data you cannot obscure the original entry. And this applies, of course, to both written and electronic changes. You want to maintain all the essential documents, right? I mean, there are requirements for maintaining its essential documents per the country that you're in. Generally, per the ICS GCPs, they should be retained until at least 2 years after the last approval of the marketed application in an ICH region, and there are no pending or contemplated marketing applications. At least 2 years have elapsed since the formal discontinuation of clinical development of the investigational product. That's a mouthful. The key here is 2 years, 2 years, 2 years. So you have to maintain them. And I have to tell you this. Clinical research sites just maintain these records for life. I have yet to be in a situation where a clinical research site has destroyed these records. They typically transfer it off to another facility and that is stored in there for life. Archiving is done. Financial agreements should be documented, right? Because we're talking about records and reports. You want to document the financial agreement between the sponsor and your institution, okay? monitors, again, need to have direct access to this information. And then, of course, progress reports. The expectation is that you are reporting per the IRB or ethics committee's guidelines. Some require it annually, some require it every 6 months, every 4 months. It just depends on the kind of child that you're working on. So you want to adhere to those reporting guidelines. And of course, if there are any events that have to be properly reported, such as significantly of things that significantly affect the change of the conduct of the child, things that increase risk to the subjects, you absolutely want to report that as soon as possible. So that's really it in a nutshell. We're making sure the data is accurate, and we're making sure that we are staying up to date with the progress of the clinical trial. We're adhering to all of those rules and regulations that have been put in place to ensure that we get safe patients in clinical trials and quality data. Super important. So let's move on. Let's lay that foundation to expand your mind so you can really understand these concepts. So we're going to talk about renunciation. And while this might sound a little bit religious, there is a lot of deep philosophical and spiritual meaning to this. So there is this idea that resist not evil, right? And whatever you define as evil, I mean, evil might just mean, evil to me just simply means that focusing on thoughts that no longer serve me. So evil are thoughts in my mind that no longer serve me. So here it says there's a great difference between resisting evil and renouncing it. When you resist evil, you give attention to it, you continue to make it real. When you renounce evil, you take your attention away from it, you give the attention that you want. So the renunciation that we're talking about here is taking your attention from the evil, which means the things in your life that no longer serve you, and placing your attention on something else. It's really simple. So long as you keep focusing on something and condemning it, it's only going to grow. Now, as we've discussed before, your controlled imagination is your savior, okay? And your attitude will be completely altered without any diminution of religious feeling, and you will say of your controlled imagination, simple. Your imagination is the redemptive power, right? It's your savior. A lot of times, spiritual or religious books have all these things in them, but a lot of times they can be used metaphorically. Whatever you consider your savior is your imagination, because it is your imagination. Remember, we talked about how your imagination lifts you above those dark thoughts, right? When you imagine something different, you're lifted from the dark thoughts, or it's like a tide that lifts you up and then carries you onto a new destination of your life. So your imagination is important. So first, how do you resist it? What do you do with evil, the thoughts, the things that no longer serve you? You basically, the better way is to take your attention away from them, and then use your imagination to create a new world that you want for yourself. So your imagination, which is in an uncontrolled state, expends its energy in useless or destructive thoughts and feelings, right? Don't use your imagination to focus on things that no longer serve you. And we do it all the time. We imagine the worst case scenario, something happens. It's just so unconscious because of the world that we live in. A majority of the time, it's all doom and gloom. And so to do the work to transcend this, I say programming that we've immersed ourselves on in this planet, it takes a lot of work. I most certainly keep doing it, disciplining myself to focus on what I really want versus condemning the things that are going on and causing them to expand and keep perpetuating themselves in my life. So, but you, just as the vine is pruned by cutting away its useless branches and roots, prune your imagination by withdrawing your attention from all unlovely and destructive ideas and concentrating on the ideal you wish to attain, right? So think about this, you can have a beautiful a tree, let's say the tree of imagination, and it could be a tree of evil thoughts, right? So you could have the beautiful tree, the center has all these wonderful good thoughts, but then you have all these branches that are your old self, the things that no longer serve you. And then all of a sudden you're focusing on the branches and the leaves, all those old things. So we want to, as we imagine the good that we desire in the world, it's like pruning the trees, right? Of all the old dead leaves, of the bark that is, hanging on the tree and is getting ready to just fall off, and we just peel it off. I heard this story of this person was driving and they saw a tree that had I mean, this healthy tree, and then there was this heavy dead tree that was just leaning on it. Just literally just, I mean, just imagine a tree that's dead and rotting, just leaning on this very fresh, you know, really beautiful looking tree with flowers and blossoms, and these other dead trees leaning on it. So can look at the dead tree like the old thoughts that no longer serve you, and you have to just push them away, and you focus on this beautiful self that is growing and that is blossoming. Okay. And again, it takes discipline. So you're pruning away the old thoughts, and you're so that you can reveal the goodness that is really in you. And again, that's what we do in clinical trials. I always go back to that because I've spent so many years in this industry and I see it all the time. When we start a clinical trial, our intention is that we're going to be successful. We're going to enroll all the patients we need to enroll globally, and we're going to submit to the regulatory bodies. And as the trial goes on, we're constantly just pruning. We're pruning away the things that no longer serve us. If there's something going on with the protocol and we're like, you know what, we've observed certain things happening in certain countries. Maybe there are some procedures that are not being done for whatever reason and is rampant. We say, oh, we're going to revise the protocol. We revise the protocol, we prune it again, and then we put it out there. So that's really how clinical trials work. We're constantly imagining the best outcome of the clinical trial. I promise you this, the reason why I enjoy the clinical trials industry is this. Every single project that I work on, everybody is hopeful that we're going to enroll the patients that we need, and we're going to bring a product to the market that will transform lives. Nobody's running a clinical trial to hope that the outcome is not going to be fruitful and productive and positive. And hence, that is why I just generally have a very hopeful demeanor, because being in this industry for 19 years and going, it's always there's a positive outcome. We are expecting, no matter what product that we're studying or researching, overall, everybody is positive because the hope is that, wow, this product can actually come to the market. So moving on, the happier, more noble life you will experience will be the result of wisely pruning your imagination. Pruning, right? You're pruning your imagination, you're pruning yourself, because ultimately it's really a pruning of the self. It's a release of the things that no longer serve me. And how do I do that? By constantly disciplining my mind, even when I'm in the worst challenges, which, like every other human being, I've experienced that, you have experienced that. And I always say, the greater the challenge, the more my success. So no matter how horrible things get, yes, I have the moments when I'm like, oh my goodness, how am I going to survive today? Or building this program even and giving everything that I have, there were challenges like every other part of life. But here's the thing, take your imagination away from that and hope for the better outcome. Hope that you too can transcend it. I mean, they're not trucking in people from Mars. You too can transcend it. You too can become something better. You too can do the things that you really want to do. So we're not resisting evil, we're ignoring it, right? So because when you resist evil, your attention is on your bad mouthing, these horrible things have happened to me, my life is going to hell. But when you take your attention away from it and you start focusing on the things that are good, wow, look at that, I'm taking this program, I always wanted to learn about clinical trials, or I own a clinical research site, I'm getting information that is really going to help me, that's really going to transform me, and I'm going to be able to use this to help my patients. See, that's a whole different ballgame there, and you can apply to anything in your life. Okay, so that was it for today. We talked about the investigator per the ICH-GCPs, the importance of maintaining good data, reporting it correctly per the IRB or EC guidelines, and then, of course, making sure that you store information so that if something happens in future, and which it has happened, we've unearthed studies and taking them back into the clinical research study because there is some data that we submitted to the regulatory bodies and their questions, and then we have to go back to this clinical research site to unearth everything. So retain those records, really important. And then Neville Goddard, we're talking about renunciation. You're pruning yourself, you're renouncing, you're not resisting. You're taking your attention and focusing it on the things that you want to work in your life. You're not focusing it on things that are not working. Because at the end of the day, I mean, if you talk a lot about the things that are not working, it's not going to make a difference, right? Really. So why not focus on something that is more hopeful? Really, I mean, what's the point of constantly complaining about something when you can't do anything about it. So take your attention away from it and then think of something better. Okay, so that's it for today. Glad you're continuing to listen. Make sure that you're joining the weekly Q&A call so that we can help you and we can really hold your hand and enrich you and provide you additional guidance and answer all the questions that you have. Thank you so much, and I will see you on the next one or the next lecture. Okay, bye-bye.